Assalamu alaikum. It's my pleasure to meet you again. My project is structured teaching program for medical interns and their emergency medicine rotation at East Jeddah Hospital. This is Dr. Ahmed Ismail and my project advisor, Professor Yasser Al-Wazir. My name is Ahmed Ismail Abdelhady. I'm a consultant in emergency medicine. I'm working as a supervisor and program director of adult emergency medicine at East Jeddah Hospital, Saudi Arabia. So what was the problem we faced and we addressed in our emergency department? So for the intern who are doing their emergency medicine rotation at our hospital, unfortunately, we don't have a standardized teaching or evaluating tool for this intern. And this leads to inconsistent competences and negatively impact on patient care, patient satisfaction, as well as intern underperformance. So we have set a goal to have a standardized teaching and evaluating program to improve patient satisfaction and intern competences. So the project has been divided into three main phases. Phase one, which is curriculum development based on the daily basis cases we are facing and we are treating in emergency department. So for example, ECG, chest X-ray, acid-base balance interpretation, approach to emergency department patient, this was the main topic for the curriculum development. Secondly, which is a faculty training, competency-based teaching workshop. After giving the workshop for the intern, we give them the feedback, and we receive also a feedback from the intern in a Google Sheet to evaluate the faculty and evaluate the curriculum for further improvement. Then we set the mentorship program where each intern has been paired with experienced ED doctor for guidance, which is the mentor-mentee program. So what we have achieved in year one, curriculum pilot tested and has been also refined based on the feedback from the faculty and from the intern themselves. Then we have conducted the faculty training session based on the structured teaching method. Thirdly, we have launched the mentorship program where we have a regular meeting and feedback from the interns. As we can see here, we set the goal for this year, starting from reviewing the competences in the Saudi Med framework. Then we set the curriculum, we have refined the curriculum again, we set the bedside teaching, simulation-based learning, and the small group discussion workshop and the mentor-mentee program. What has been achieved and what were our success? We firstly improved the patient confidences and the clinical skills. Secondly, in positive patient care where there will be few errors and improve patient safety. And thirdly, enhanced communication and teamwork in emergency department where all intern and doctors, senior and junior, talking the same language in emergency department. What were the challenge and solution in this year? Firstly, we have a faculty resistance which has been solved by additional training. Secondly, scheduling conflict in a busy department, and this also has been solved by integrating teaching into clinical workshop hands by hands. What will be my next step in this project? To expand the program to all hospital internship rotation, not just an emergency department, and to add advanced simulation and case-based learning session, and to strengthen the evaluation tool. Sustainability for my project is by continuous monitoring and involve the stakeholder in the decision making and incremental improvement. Thank you very much.